Okay, well, thank you for this great debate and great conference in general. I wanted to come back to Michelle's question about the, anti-diabetes and anti-obesity drugs. I think, I understand both of your point of view. I do think we don't want to be in this equilibrium where everybody starts taking these drugs because they want to continue eating junk food. Especially since, and there I don't know about the scientific evidence, there may be an opioid-like property of these drugs that somehow, in the short term, they work very well. Just like, opioids, you want them to, if you have an operation, not to mention terminal cancer, but not for back pain, because basically it won't work. So I hear that people who take these drugs and then they stop it, then they get back their weight. And so that I think is a big issue, especially if we don't manage. And it is amazing the power of the junk food industry. We have this, to get a vaccine approved, you need to do a lot of things, a lot of tests, but randomized controlled trials are not needed for Big Mac. So at some level, we need to think indeed globally in terms of solving these issues together, I guess. And it's very, very complicated.
Antoine.
Yes, I think what you are saying is very important. We need to be cautious. We need to see the safety profile of these new drugs. But we have to know that these drugs are not totally new. We have now cohorts of randomized clinical trials followed up for more than 3 years. And what we see is that they are, for the moment, not prone to a lot of adverse events. There are some gastrointestinal adverse events, which are frequent but very not severe, but sometimes severe enough to stop the drugs. So there are a problem of compliance. All of the patients will not continue the drugs, which is sure. And the second point is that it is true. There are some trials which show that after 1 year of stopping the drugs, it continues to have a good effect on the weight, for instance. But what is sure is that the weight is rising again when you stop the drug. Like the statin, you have to take the statin for all your life, almost, when you have an hypercholesterolemia. So it is, and for high blood pressure too. So it's possible that these drugs will need to be taken for a long time. It's true that they are too expensive, maybe not completely affordable for our health system. So we need economists here to see, because if they avoid some complications, some long-term effects of obesity, maybe it will be helpful to have them, even at a price. So for the moment, it's a bit early to have sharp and definitive conclusion, but we need to remain open. It's what I wanted to say.
Thank you. We had a question there. Was it about the lack of data?
Well, I want to reply to Deborati.
Yeah.
It is nice bringing down the silos, but have you ever thought about the enormous cost due to the standardization of the system involved? Because they should communicate. They are now using certain technologies, but at the same time, there is no consistency about that. So you are collecting data that ultimately you cannot use even.
Yes, of course.
Yeah, you're right, but it's recognized very well. Now, we have started a new initiative called MERGE.
Yes.
And the MERGE initiative, funded by the Rockefeller Foundation
in New York.
And for which I'm going to be leaving in about 20 minutes. The MERGE initiative, it's really new. The MERGE initiative, you're spot on, brings together 6 of the biggest global data sets, 6. We've just chosen 6 because we know them and they come from 6 different disciplines, right? So the Max Planck guys are there, the Columbia Climate School is there, and so on and so forth. World Pop, Southampton University. So there are 6 of them. The biggest challenge, people want data. I'm getting calls from World Bank, where's the data? Do you have any data? Can you send the data? The biggest challenge and the most expensive challenge, but for which we have the funding, most expensive challenge is exactly what you're saying, is integration and harmonization. So,
Also quality of the data.
Yes,
Also quality.
Absolutely. But here, we have avoided a little bit that problem by taking databases from scientific groups who are at the top of their métier, top of their profession. So we've avoided that. But the biggest expense is this integration and harmonization. And the problem with integration and harmonization is that it is a non-visible good. You can't show anything for it. You have data, you can show it. The integration and harmonization procedures is an invisible good. And so we've had a lot of effort to get the funding for it, but we'll get there.